Hi there, I'm Dr. Giyaur of New York Laser Vision, and today I'd like to discuss a very interesting topic, interesting to me and to many of my patients, and that's laser vision correction. So laser vision correction, or LASIK, or sometimes LASIK, is a procedure where we correct either nearsightedness or farsightedness or astigmatism by doing a laser reshaping procedure on the cornea. So cornea is the surface of the eye. It's a very, very superficial, very first layer of the eye that we see when we look at a person. And some people, the eye doesn't work properly. For example, nearsighted, where we see very well up close, but we can't see far at all. Or some people are farsighted, where the distance vision is pretty good, but up close a person can't see much without using glasses. And then there are people with astigmatism, which is a fairly common problem, and those people you can't focus well up close or far. So laser vision correction procedure we've been doing it for over 20 or 30 years. And the procedure basically reshapes the cornea to give our eyes better focus and to eliminate the need for either contact lenses or glasses. So laser vision correction is an outpatient procedure. It's done in the office or in a laser center. It takes about 15 minutes. And it's fairly painless. There's a little bit of pressure sensation at some point during the procedure, but other than that, there's not much to it. Then for a few hours, the eye doesn't see so well, and the person feels that there's something in the eye, and it might be a little bit teary and uncomfortable. But in a couple of hours after that, the vision starts improving, and then it keeps improving and continues to improve. So by the time the next day comes, the vision is much better, but the full healing takes about 2 weeks to fully complete. It's a great procedure. It's approved for ages 18 and up. So as long as the eye is healthy, it can be done pretty much on any age, as long as there's no other problems in the eyes. Usually what we like to make sure is that the person's prescription is very stable. It's not changing. So some 18-year-olds may not be great candidates because their numbers may not be stable yet. And then we make sure that there's not too much dryness, that there's not too much damage, let's say from contact lenses, and some people do need to stop wearing contact lenses a little bit in advance of the procedure. And we make sure that the eye is healthy overall. So most overwhelming majority of people are good candidates for this procedure. Now, a lot of people ask me, I like wearing my contacts, and is it a good idea? Maybe I'll just continue wearing my contacts instead of getting LASIK. And the reality is that contacts are probably the least safe method of vision correction, even though we have really advanced technology of contacts, and contact lenses are great nowadays compared to what they were before. But in reality is that we as ophthalmologists, we see a lot of issues related to contact lenses. For example, allergic reactions and dry eyes and infections. So the contact lenses are not so benign, they're not so safe. So glasses obviously is probably the safest, the best thing that you could put on your eyes, but they're not comfortable for everyone. Not everyone likes to wear glasses. Some people do sports, and then glasses become really a nuisance. So in those cases, when people are uncomfortable, when people do want to see better when getting out of bed right away, we do recommend laser vision correction. And honestly, contact lenses is the least safe thing, even after laser vision correction, because of how safe laser vision correction is now. LASIK has gone through a lot of steps and a lot of progress has been made in the technology that we use to perform LASIK. So at this point in time, it's a 10-15 second correction, sometimes even 5 for some smaller prescription. And it's extremely safe when done at the right time on the right candidate. Another common concern of our patients is, can I afford it? And the reality is that if you're spending hundreds of dollars a year on contact lenses or glasses or whatever it might be, you probably can afford LASIK because it's a one-time deal. You get it done, you have a guarantee. If you need a touch-up, you get a touch-up that's included in the cost of your original procedure. And we offer financing that's completely interest-free. So between all of those things, the procedure becomes just a lot more affordable than spending hundreds and hundreds of dollars on, contact lenses and contact lens supplies, etc. So that's really, as far as affordability, the procedure is quite affordable at this point in time. So if you'd like to know if you're a good candidate for our advanced LASIK procedure, please give us a call, schedule your complimentary consultation, and I'll be happy to see you.